American Chiropractic Association says back pain is the single leading cause of disability, preventing many people from engaging in work as well as other everyday activities. So when it reaches to that point, it may be time to talk to our neurosurgeon in tonight's Healthy You. Back pain accounts for more than 264 million lost workdays in the year. That's 2 workdays for every full-time worker in the country. And experts estimate that up to 80% of the population will experience back pain at some point in their lives, young and old. Neurosurgeon Robert Funk of United Regional has seen everything from back and neck pain to tumors in the brain and says to treat the problem, you have to understand what it looks like first.
Damage to the spinal cord itself would probably lend to symptoms mostly of weakness that people would know. Sometimes they have sensation loss, meaning that they would have difficulty feeling things normally. Things wouldn't feel hot or cold. Once you get to the point where you've lost a lot of ability to walk, you can start experiencing difficulty controlling your bowel and bladder function, which unfortunately people wait that long sometimes to seek medical care.
Causes of spinal cord trauma can vary from chronic illnesses to an acute injury from something as small as a fender bender that goes untreated.
Oftentimes nerve injury is kind of an acute thing. It doesn't really, the nerve injury doesn't develop over time. What develops over time is muscular injury, ligamentous injury, those kinds of things. You can still have instability of the neck that may need to be addressed. It's always possible too that you could have had a fracture at the time of your injury.
Something massages or physical therapy won't fix. In these circumstances, surgery is needed.
Neurosurgery is a little bit scary when you say the term because people think about brain surgery, spine surgery as being a scary thing. Part of it is that you have to just inform anybody that's going to potentially undergo a surgery what all is going on. Oftentimes on imaging we'll see compression of the spinal cord or the nerves that may need decompression type surgery. Occasionally they may need some type of fusion which can be accomplished both from the front and from the back of the spine.
Just like the Metroplex, United Regional is implementing ways to create faster recovery times and limit the use of opioids during the healing process, such as the use of liposomal numbing medications.
They have new forms of that can last in the fat and muscle tissues for up to 3 days that can be used. There's also other techniques using muscle relaxants and anti-inflammatory drugs that can help without using opioids.
And when it comes to your overall well-being, Dr. Funk believes convenience is key.
Having to drive a long drive after you've had a big surgery or find a hotel to go to and sleep in a bed that's not your own, those kinds of things can be frustrating when you're trying to recover from a surgery. If you know that you just have to go back down the street to your own home and the surgeon who performed the surgery is, very close by, that's really nice to know and give you comfort post-operatively.
If you'd like to contact Dr. Funk for a consultation or for more on the spinal injury treatments at United Regional, just go to Texomashomepage.com and search Healthy You.